C-sections. And if someone tells you, well, you're approaching menopause and you really don't need your ovaries because they stop working, don't buy that. The ovaries continue to work beyond menopause, okay? They produce significant amounts of androgens, which then can be turned into estrogen. And if your doctor disagrees with you, just ask them, then why do I need hormone replacement therapy after I have a full hysterectomy? Well, it's actually because you don't have the ovaries to produce those female hormones anymore. Okay, consequences, the side effects of hysterectomy. Well, the big one is going to change your figure in a very negative way, because when you cut this band of ligaments that are attached to the uterus, those ligaments are also attached to the spine, the hips, part of your pelvis, and basically you're collapsing the internal part of your torso, the core of the inside of your midsection. That causes the hips to widen. That causes the rib cage to shift downward. It can also give you a shortened, thick midsection appearance and a protruded belly. And many times when you hopefully see an informed consent, you don't really see this side effect. Number two, lower back pain. Why? Because you just created a lot of instability in your pelvis, not to mention the potential for a leaky bladder and a loss of libido, which is number four. Number five, emotional roller coaster. It can really affect your emotions because if there's any fluctuations of estrogen or progesterone downward or upward, that can affect your emotional state of mind. Number six, fatigue. Number seven, it can increase your risk of getting fractures because now you're in a state where you could potentially get either osteopenia or osteoporosis because of the loss of estrogen. Number eight, it can increase your risk of all-cause mortality, including coronary heart disease. Now, sometimes they'll say, well, you know, you're going to take your ovaries out. That way it can decrease your risk of potentially getting ovarian cancer down the road. So you're going to take out an organ to prevent cancer from developing in that organ, which, by the way, ovarian cancer is rare, especially if you're going to compare the death from ovarian cancer to the increased risk of dying from a hysterectomy. This is a much greater risk than getting ovarian cancer and dying from ovarian cancer. Number nine, an average female who has a hysterectomy gains 25 pounds within the first year.